Welcome dear student. Today we discuss in the course of Determinant of Quality Life. Topic name is Lifestyle Diseases as Stroke and Cardiovascular Conditions. Learning outcomes of this module is by the end of this session, learner will be able to define cardiovascular diseases and different type of stroke, ischemic and hemorrhagic. Identify key risk factor contributing to the developing of CVD and stroke. Explain the physiological mechanism involved in heart disease and stroke. Discuss effective lifestyle and medical strategies for preventing cardiovascular diseases. Describe modern diagnostic technologies used in detecting cardiovascular issues. Outline various treatment options including medication, surgical interventions and rehabilitation. Demonstrate an understanding of importance of regular health checkups and stress management in maintaining heart health. Cardiovascular diseases CVD and strokes are critical global health challenges affecting millions worldwide. Understanding this condition in the first steps toward prevention and management. The good news is that most cardiovascular issues are preventable with lifestyle changes. This prevention will cover definitions, risk, prevention, and treatment related to this condition. Cardiovascular disease and strokes are leading causes of death globally. CVD causes approximately 17.9 million deaths annually, representing 31% of global death. Many are preventable through lifestyle changes such as diet, exercise, and stress management. What are the cardiovascular diseases? Cardiovascular diseases are a group of disorders of the heart and blood vessels. These include coronary artery disease, heart failures, arrhythmias, and congenital heart defect. Coronary artery disease CAD is the most common type caused by narrowing or blockage of coronary arteries due to plaque buildup. Impact of cardiovascular diseases can lead to chest pain, angina, heart attack, stroke, and even sudden cardiac death. It can significantly impair quality of life and functioning. Global and economic impact of CVD. CVD is a leading cause of premature death and disability across the world. It not only shortens lives but also leads to long-term physical limitation. It is economic burden. Billions of dollars are spent each year on treatment, medication, hospital stays, and rehabilitation. Lost productivity due to illness and death contribute to overall burden. In developing countries, the growing incidence of CVD challenges already fragile healthcare system. Global and economic impact of CVD. CVD is a leading cause of premature death and disability across the world. It not only shortens lives but also leads to long-term physical limitations. Billions of dollars are spent each year on treatment, medication, hospital stay, and rehabilitation. Lost productivity due to illness and death contribute to overall burden. In developing countries, the growing incidence of CVD challenges already fragile healthcare system. Anatomy of heart disease. Atherosclerosis, that is the calcium deposition in arteries, is the underlying process behind most heart diseases. It involves the buildup of fatty deposit plaques in arterial walls. Atherosclerosis involves fatty plaques build up in arteries, narrowing them and reducing blood flow. Plaque rupture can cause blood clots and heart attack. Key point of atherosclerosis is plaques are made up of cholesterol, fat, calcium and cellular waste. Over time, they narrow the arteries, reducing blood flow and oxygen supply. If a plaque ruptures, it can form a blood clot that blocks blood flow completely, leading to a heart attack. Risk contribution is high LDL, bad cholesterol, chronic inflammation, and high blood pressure and smoking. What is a stroke? A stroke occurs when blood flow to a part of brain is interrupted or reduced, preventing brain tissue from getting oxygen and nutrients. This can result in severe disability or death if not treated promptly. A stroke happens when blood flow to the brain is blocked or reduced. Types ischemic, that is blocked arteries, or hemorrhage, that is vessel rupture. Effects of include paralysis, speech problem, and memory loss. Types of stroke is ischemic stroke caused by blockage of the brain arteries by a blood clot, that is most common. Hemorrhage stroke caused by rupture of a blood vessels in a brain leading to bleeding. Effect of these are, depending on the area of brain affected, stroke can cause speech difficulties, paralysis, memories, loss, or even death. Ischemic stroke, mechanism and treatment. This is the most common type of stroke caused by the clot blocking a blood vessels in the brain. Treatment like clot busting drug or mechanical thrombectomy aim to quickly restore blood flow and minimize brain damage. Mechanism of this treatment is caused by thrombus, local clot, or immobilus, clot traveling from elsewhere or blocking a cerebral arteries. Brain cells begin to die within minutes due to the oxygen deprivation. Treatment of this ischemic stroke is TPA, tissue plasminogen activator, a clot busting drug used within 3 to 4.5 hours. Mechanical thrombectomy is procedure to physically remove the clot. Prognosis: the quicker intervention, the better the outcomes. Long-term disabilities may include partial paralysis, cognitive issues, and speech impairment. Hemorrhagic stroke, cause and complications, occurs when a blood vessels in brain ruptures, causes bleeding. This can increase pressure in skulls and severely damage brain tissues. Treatment often involves surgery or long-term rehabilitation. Causes of the hemorrhagic stroke is caused by ruptured brain vessels, leading to bleeding and pressure on brain tissue. Types of this: intracerebral and subarachnoid hemorrhage. Treatment involves surgery and managing complications like brain swelling. Types of the hemorrhagic stroke is intracerebral hemorrhage, bleeding within the brain tissue, and subarachnoid hemorrhage, bleeding into the space around the brain. Complication of hemorrhagic stroke is increased intracranial pressure, brain damage due to bleeding, long-term neurological deficit. Treatment of this hemorrhagic stroke may involve surgery to repair blood vessels, reduce swelling, and manage complications. Major risk factor for CVD and strokes. First of all is obesity. Affect 42% of US adults, leads to hypertension, high cholesterol, and insulin resistance. Diabetes increases the risk of heart disease 2 to 4 times. Sedentary lifestyle leads to weak heart muscles, poor circulation, and increased fat accumulation. Smoking damages blood vessels and increases clot formations. Genetics. A family history of heart disease raises personal risk. Stress promotes harmful behavior like overeating, alcohol use, and smoking. Prevention strategies is physical activity like exercise, at least 150 minutes of moderate intensity activity weekly. Diet, Mediterranean style diet reduce CVD risk. Stress management technique like yoga and meditation help. Health screening, regular check by cholesterol, blood pressure, etc. Recommended 150 minutes per week moderate exercise plus 2 days of strength training. Benefits of this exercises is strengthening heart muscles, improve circulation, aids in weight management, and lower blood pressure and cholesterol. Prevention in diet and stress management is healthy diet, heart healthy diet. Follow the Mediterranean diet rich in fruit, vegetable, whole grain, legumes, nuts, and olive oil. Limit saturated fats, trans fats, sugar, and salt. Stress management techniques like mindfulness, meditation, yoga, and deep breathing help reduce blood pressure and improve emotional well-being. Regular screening of blood pressure, cholesterol, and glucose check, early detection, early intervention. Diagnostic technologies is CT and MRI scans, visualize blood vessels, detect blockage, and identify brain damage post-stroke. Blood test is LDL, SDL, and triglyceride. C-reactive protein for inflammation. Genetic profiling identifies inherited risk, especially useful in families with the history of CVD. Wearable devices, smartwatches, and ECG monitors can detect regular rhymes like arterial fibrillation. Treatment approaches in medication is statin, lower cholesterol, blood thinners, prevent blood clots, example aspirin, warfarin. Lifestyle program help patient adopt and sustain healthy habit. Focus on diet, exercise, smoking cessation. Surgical intervention is angioplasty, open narrowed arteries with a balloon. Bypass surgery creates new path for blood flow. Cardiac rehabilitation, structured program involving supervised exercise, counseling, and education helps patients recover and prevent recurrence. Taking control of heart health, adapting a heart healthy lifestyle, staying informed, and having regular checkup can prevent most cardiovascular problems. Prevention is more effective and less costly than treatment. Prevention is more powerful than treatment. Small lifestyle changes like walking more or eating more vegetable can have long life-term benefits. Get regular checkups and know your numbers, BP, cholesterol, and BMI. Stay informed and empowered through health education. Conclusion: empowerment through education is a key. By understanding the causes and strategies for managing cardiovascular conditions, individuals can take control of their heart health and lead longer, healthier lives. Cardiovascular diseases and strokes are serious but largely preventable. Awareness, early detections, and lifestyle modifications are key to reducing risk. Empower yourself with knowledge and take proactive steps to protect your heart health. Thank you.